We've got a caller on the line. Welcome to Battling and Beating Cancer.
Hi, thank you. Now, my question is, I've often heard, I heard the term a lot when I was growing up, but not so much now, bedside manner. How important would you say that is in one's struggle for cancer, and what do you do if you have a doctor or team you don't think is very supportive in that sense?
That's an excellent question. Bedside manner is very important for a number of reasons. I mean, your mind and your spirit's in this as well as your body. And so if you don't feel comfortable with your doctor, if your doctor doesn't communicate with you so that you understand and you feel like the doctor has your interest in heart and you understand the treatments and you feel confident in the treatments that you're going to undergo, then you're not going to do as well as you will with another doctor. And in Chicago, for example, if you've got blood cancer, we've brought on this program lots of doctors that are not only the best of the best in terms of their technical skills, but also doctors who are wonderful, caring individuals. And that's what you deserve. You deserve the best treatment all the way around. And so insist upon a doctor with a bedside manner. Now, I will say this, as I welcome Charlene in person, and honey, you look beautiful in your t-shirt. If you have a choice between a doctor that knows their stuff and a doctor that you like, go with the technically sound doctor, but you can usually get the whole package, can't you?
Right. Boy, I'll tell you, the traffic is terrible. This is the worst traffic I've ever been in. So you want to stay out of Chicago traffic.
I know, but the show is Battling and Beating Cancer, not Battling and Beating Traffic.
It's battling traffic too. I think I'm going to get a helicopter to get here from now on. We were just kind of talking to you from the car, of course, but
you look much better in person, though.
We were talking about there's a lot of things when you go into the hospital, like we talked about. And again, my mother, this happens to many people. They go in the hospital and they get caught up in the infections, and so you have to be very diligent in trying to watch your own health care too.
Yeah, and you know, one of the things, a lot of times people feel rushed into something. You need this operation now. And there are occasions when you really do need something immediately. But most of the time you have time to sit back, think about it, consult with your family, consult with your doctors, and make the right decision. And you got to remember that patients are dollars for doctors a lot of times. And they're not all the great, good, ethical doctors that we have on this show. They run the gamut. And so a situation.
We love our doctors. Yeah, we love our doctors.
You know a situation where a friend of yours was told that they had cancer. She had cervical cancer and needed surgery immediately. And it turned out what?
Turned out she didn't need surgery. She didn't have cancer. She had a couple abnormal cells. But this happens a lot of times. That's why we always say get a second opinion. And if you can, get a third opinion. And your good doctors will actually, they know you're going to get another opinion. So, and if they're offended by that, then you need to find another doctor, because you know, it's important that you get at least a second opinion. When Scott had cancer, and I'm going to talk a little bit about Scott really quick.
That's a boring subject.
In how I don't think we've ever talked about how you were diagnosed with your cancer. And I'll do it briefly because I know we don't have a lot of time, but we were on our way to Disney World, and
we didn't even win the Super Bowl. But...
No, we didn't win the Super Bowl, but we were on our way to Disney World anyway. So we actually, he had just a small pain in his chest, and I said, well, heart disease ran in his family, so I said, go in to get, to the emergency. Before we leave, we had a 3 o'clock flight that day, and he went in and to this urgent care place. They took him to the hospital. Said he called me, said, I have a mass in my chest. So he just had very simple, not too bad of,
some indigestion.
Yeah, indigestion and little
and the
pains.
day before, it felt like I had some weight on my chest.
Yeah, so we went in there, and they said, you have a mass on your chest the size of 2 baseballs. So when I ran to the hospital real quick, needless to say, we never made it to Disney World. But that started our adventure on, doing stuff for cancer work. And he went through, it was just, you're dealt with this really fast, and you're trying to deal with and take everything in. So he had major surgery and thoracic surgery and open heart surgery, chemotherapy, 6 months of chemotherapy, 6 weeks of radiation. So
and then they found out I was a lawyer, and they said, let's try electrocution on this guy.
Yeah, then they wanted. I said, no. He's a good lawyer. There are good lawyers out there too. So, you have to take things as it is. But even then, when he was diagnosed, because we went to the emergency room, and when they didn't know his name, they got his name wrong. I said, okay, we need to get out of here right away. So. That's why we went to another doctor, and then we had 3 opinions. So it's really, really important that you get as many opinions as you can. So
right, if they agree, it just gives you more confidence.
Right.
If they don't,
right.
First of all, then you have some options and some choices. But then you've also seen 2 or 3 doctors to see which one you feel most comfortable with in terms of the treatment, and as the caller had suggested, in terms of their bedside manner. Who do you connect with? Who do you feel comfortable with? And I think the other thing is, when you're a cancer patient, you're still a person. And it's important to go on living your life.
Yes.
When you look like me and you have cancer, you need a sense of humor. Stay in your routine to the extent that you can, because you feel like you have a loss of control. But to the extent that you could do the things you did before, do them. Pamper yourself and be patient with yourself and be gentle with yourself on one hand, but don't be too patient or gentle with yourself. You either need to give yourself a kick in the pants sometimes, or you have your wife is happy to do it
That's
for
right,
you.
I'm here for it, so I'll give him a kick in the pants. But no, try to do your day, try to do as much as you can. Plus, not only are you, staying with your normal routine of your daily routine, but you're also taking your mind off of, the what ifs. What if this is bad? What if this isn't bad? And it helps you.
Yeah, the if and what if will drive you crazy.
It helps you mentally to get out and, take away, because you don't want to constantly focus on what your disease is and stuff. You want to move away from it. So, do as much as you can. And I know it's in your back of your mind constantly, but you know what? You have to move on with your life. And with Scott, he went to work. And when he couldn't go to work on his bad chemotherapy days, he worked at home. So, he went on with his daily life, even though I put a mask on him when he got on the train and stuff. I didn't care. But try to do as much as you can with your regular routine.
And take advantage. Look, everybody sort of feels like I'm the only one with cancer. That's how I felt, even though by the lines at the cancer centers that business is really good and everybody seems to have cancer. But there are so many things out there to help you. There are organizations like Chicago Blood Cancer Foundation. There are buddy systems and networks that you can connect with, that even if you have loving, caring family, you can talk to people who have been through what you're going to go through, and you can know, because you could touch somebody who made it through, and you can get their tips, because they can tell you things and spend time with you that the doctors can't. Rely on your family. Trust your faith. I mean, getting cancer is sort of like going to jail, which is, if you don't have religion going in, you seem to wind up with it, because you need that to sustain you. You need that belief.
Yeah. And again, and talk to your doctors, because now, like with some of the doctors we've had on here with the hospitals, they have social workers, they have mental care workers, they have, they're dealing not only with the body itself, but they're dealing with the mind and body and spirit and everything, which I think is a good approach, because you go through so many emotional things. You have to talk to somebody. You have to talk to people, and again, they're good and bad and everything. And we try to bring onto this program, CAN TV program, the best doctors there are out there, the best university hospitals, the best hospitals, researchers, because if we bring them on, we have confidence in them. Otherwise, we will not bring anybody on that we don't, because there's a lot of bad doctors out there, and we know some of them. So, but we try to bring you the best, and that's the most important thing you can do, is get the best care you can, and however you can, get it.
And look, there is no form of cancer. Some cancers are worse than others. That's true. But there's no form of cancer that has a 0% survival rate. There is always something that doctors can do. There is always hope. I think keep hope alive, as Reverend Jackson used to say. I mean, it really applies. You need to keep that hope. And if your doctor isn't giving you hope, fire your doctor. Be Donald Trump and go to a doctor that will. There are lots of treatments available. There are clinical trials. Be cautious, though. Don't go for the panaceas, for those sort of experimental crazy things, even though you think you might be saving yourself from some of the side effects of traditional treatments. Be knowledgeable, be informed, surround yourself with the best in terms of doctors. If you have family members that are vexations to the spirit, get rid of them.
Yeah, and do the standard treatment they have nowadays. And like Scott said, don't go with the voodoo doctor type, things. Do the standard treatments.
And it's one time where really reach out for help.
Yes.
Reach out. People are there for you, family, friends, organizations, your
church,
doctors.
Your church.
Absolutely.
Yeah, I mean, you have a lot of ways to go, so...
So this was just a fabulous show. We know you all enjoyed it.
Yeah, and I just ran in, and I'm going to run out in now.
She's like Superwoman from traffic into the studios.
I need a helicopter.
Phoning it in,
Okay.
appearing live. And we will join you back here next week, next Wednesday night at 7:30, right here on CAN TV for Battling and Beating Cancer. Good night.
Good night.